We begin tonight examining what experts say Nebraska is losing out on millions of dollars because of overdose deaths going unreported. Good evening. I'm Erin Sullivan.
And I'm Brian Mastery. The sad truth is those dollars, money not coming into the state, could actually be used to prevent overdoses. I talked with a reporter from the Flatwater Free Press who's been digging deeper into this story on why getting the real numbers affects all of us.
We've got to start treating addiction as a public health crisis in Nebraska.
Paul Weisapple knows the odds.
I didn't choose to be a heroin addict at age 18. I got hurt playing soccer and I started taking some hydrocodone. I was just lucky to make it out. I had 7 overdoses of my own.
Many of his friends didn't make it. Something wasn't adding up. He knew they had overdosed, but he often learned later the death certificates didn't say that.
Frustrated that Nebraska didn't have data that reflected my reality, and it still doesn't.
Nebraska has long celebrated its ranking as having the lowest drug overdose death rate in the United States.
It is often referred to as a good thing and a point of pride for the state, but nobody I talked to thought that those numbers were true.
Destiny Herbers is a reporter with the Flatwater Free Press, an independent nonprofit newsroom in Omaha. Her investigation found that many county attorneys, unless it's a suspicious death where someone could be facing charges, don't ever order an autopsy where toxicology could determine whether it's an overdose.
As it stands now, the cost of an autopsy comes out of the county budget. And I'm sure you can imagine that is burdensome for some counties who are very, very small and operating with sort of skeleton crews. So I do
could be what, $4,000 or $5,000?
Yeah, and the only public place to have an autopsy done is actually Douglas County's morgue.
Substance abuse grants, money to help people recover, are largely based on overdose data. Destiny Herbers calculated what underreporting overdoses cost Nebraska.
Over time would have equated to like $50 million more in funding for substance abuse treatment, which could have really probably changed things for the family that I worked with for this story.
For Paul Weisapple, his job now is at UNMC, using his experiences to turn around lives.
My hope in the next few years is to create a scalable model of a drug detox that within the University of Nebraska system, where we can truly treat people on their first day during their most uncomfortable moments to give them a better chance at this.
Now, other states have a more centralized medical examiner system. That's one solution to help with better reporting and cost savings with the help from the state. To learn more about that, how we got here, plus the personal story of one family who believes better data could have made a difference in their son's life. We have a link to that story in the top-notch coverage in the Flatwater Free Press. It's connected to this story at firstalerts6.com.